Fine. Okay. So my name's Kunal. I'm one of the registers on the children's ward here. Are you guys all doing paediatrics? Some of you are not. Is that at the moment? Who's not? Okay, cool. What are you guys doing?
Cherries.
We're doing Jerry's, but within
In the middle of our
paediatrics.
pizza rotation.
Yeah, it's the CHDA, isn't it? Yeah, that's fine. Okay, so we were going to have a presentation today on retinoblastoma. I think someone was going to talk about. So next time maybe you'll hear that. I don't know. But I have prepared some stuff today. You guys are taking notes. Very impressive. So what I wanted to talk to you guys about today is just some really base bread and butter paediatric stuff. Which Sam, you were in clinic with me this morning. We did a lot of it this morning. So I want to talk about growth charts. Yeah, have you guys been through any? Used them? Familiar with them? You can be honest and say no.
In second year they cover them, and it's potentially a second year OSCE station, so we sort of would have known it then. It was a little while ago.
But no one went through it with me though.
Very well. Yeah.
No.
Okay, so a bit of a mix. Okay, so what I've got is I've got a few activities that I think we can start off with. Just to get you some practice. Now I've got a mix of boys charts and girls charts. If we pass them round, there may not be enough for one each, but if you share some round, is that right?
Yeah.
Hopefully this will work. Some of the material may not match up entirely. Have you guys got enough there as well? They've got enough. If you want some as well. So I've got some more. So before we crack on, anyone hazard any ideas, open any ideas to the floor about why growth charts are important, why we use them in paediatrics?
Track child's growth,
Yeah.
progressing in
Yeah.
their growth milestones. If you
Yeah. What else?
If they start to like cross lines or fall, then you know something wrong. Or
Yeah.
Hey gang.
Yeah, come in.
Oh, this is going to be cozy.
Yeah.
There's
Come in, come in.
3 of us. We'll just sit on the floor.
Oh, you alright? Okay, no worries. So we're just talking about growth charts in paediatrics. Alright, so as you guys, I haven't met some of you guys, so I'm Kunal, I'm one of the registers on the ward here. Okay. So we were just saying that growth charts are useful because they can help us track a child's growth. And sorry, I don't know your name. You were saying, Abby. Sorry, you were dealing with me last week. You were saying that you can see if they're starting to fall off their centile. So that can be useful for picking up sort of long-term or general health problems if they start to stop growing. So that's one of the things that we often pick up in children. And the other really important thing for you guys is that it comes up in exams. Massively important reason to learn how to use it. Okay, so I have got an activity for you guys just to start off with. So you may need to scribble this down because I've not had a chance to photocopy everything just yet. Okay, so I'll read out a quick thing for you. So your scenario is that Stephen was born at term on the 21st of January 2008, weighing 3.5 kilograms. His head circumference was 35 centimetres. When Stephen was 8 weeks, his weight was 4.7 kilograms. His mum's brought him to the clinic today, which is the 28th of October 2008. And his weight today is 8.4 kilograms, and his length is 71.5 centimetres.
how many weeks was that one at? That last one?
So this one is on the date of the 28th of October 2008.
So how many weeks?
Like
So you know his date of birth, and you know today's date.
What was the day of birth?
Date of birth is the 21st of January 2008. Okay. Have you guys got both boys' growth charts? Some of you have got girls' ones. If I give you one of those, you guys feel free to just pair up a little bit. Why don't we, if you share this chap here, and we pass one down a bit further down the other end of the room. Okay. So what I want you to do is plot some of these measurements for me and see what you're getting. Okay. So if I give you a few minutes to do that. Yeah. So you can scribble on the charts, that's fine.
Yeah.
All we have is
Careful.
Yeah. Okay. So at birth, he was
3.5.
3.5 kgs. So and his term.
Yeah, term.
So what is terminal?
So weight is here. Yeah.
Yep.
3.5, nice and easy, it's there.
Yeah.
And you sit as dotted.
Yeah.
I had to say I did it as crosses and I was going for it. You're meant to do it.
Okay.
At
8 weeks was 4.7.
4.7, 8 weeks.
These are the months, right? And these are the weeks. Okay,
Yeah.
fine. 8 weeks is 4.7.
So 4.5.
It's like big.
In between, yeah, two-fifths of the way up that one.
Yeah.
And then 8.4. So how many? We need to work out how many weeks he is or months he is. 28, 52.
9 months.
He's 9 months and a week.
36 weeks. Roughly. 37 weeks. No. Yeah, 37 weeks.
9 months he'd be.
About 37, but
Well,
then.
it's 9 months, 36, but then it's 1 week extra. It's
Yeah, so that's
37 37 weeks.
But then that puts him below 9 months because these are not
Why are you
months.
saying 37?
Like,
Yeah, so maybe we
so
could
we
do
should
like
put it at
10.
9 months. Yeah, 9. So he's 8.4.
That's 4 weeks, 20 days.
I'm going to give you guys a few minutes to do this. I'm going to come right back. Okay? Yeah.
I would just use
No
that.
cheating.
So this is showing you, yeah, 9
Little
months,
lines.
which is 39 weeks, and a week later 40.
Remember, I'm watching
Yeah.
that video back.
Yeah.
8.4.
And then we need to do his length, his head circumference.
Head circumference at term was 35.
35. So head 35. So
Straight on there.
literally straight there, yeah. And then his length 71.5 at the same 9 months.
71.5. Oh, it's here, sorry. Fine, 71.5, so there. Maybe?
70, yeah. And then, yeah, like close to the 2.
There?
Yeah.
Just so
Okay. Cool. So where is he sitting? So he's on 50th centile on your volume. But he did drop a bit. So he's then. What do you say when he's in between the centiles? What would that be?
He will still be in that sense.
So would you say he's the 9th or the 25th? Because he hasn't quite made the 25th.
He'll be in the 9th
Or
centile.
would you say that he's in between, so like the 12th?
Good question.
Yeah, okay.
Like that.
And then he's like above the
Above the
25th.
25th, yeah.
So he did drop a bit there. Because he should really
What's he
go
called?
50.
No, but it does matter if you dropped 2 centiles. It's only if it's more than 2 centiles, then that's when it's more.
When it's significant. Yeah, but we're just saying commenting that there was a drop. It doesn't mean that it means anything.
Okay, so I'll give you 2 more minutes, yeah?
And his head and his length they're both pretty 50th.
Yeah.
So he was born 50th and 50th.
Yeah, and it's again about the 25th.
They should be more. If you're really tall, you should also weigh more. If you're not tall, but sometimes you're gaining weight, it's just height.
Questions, plural. Okay.
Okay.
Okay, are you guys done at the back? Yeah? Cool, okay. So we've got a few questions. The way I was going to do this was as a little quiz to get it all done together, but we're a bit low tech today. Okay. Are you guys done there? So I was going to do this as a little quiz on a screen, but we're obviously a bit low tech today. So I'll read out the questions, and then if you just shout out your answers back at me, okay, and we'll see what we've got, and then we'll see what we can work with. So, first question was, what was the weight centile at birth?
50.
University, nice. And what was his head circumference centile at birth?
50.
And what was his weight centile at 8 weeks?
Just below,
Between.
below between 9 and
Yeah, between 9 and
Okay. What have you guys?
9 and 25.
Yeah.
That's what we got.
Is that what everyone's got? Okay. And how old is Stephen today?
40.
9 months.
9
1
months,
week.
1 week.
Very nice, very nice. And what's his weight centile today?
25th.
Just above the 25th.
Okay. And what about his height centile?
Between
25th to 50th.
25th.
Very nice. Very good. We're working with people that know what they're doing, which is always pleasant. So, okay. I haven't done that exercise because I didn't. For some reason I should have done probably, but never mind. So, that was just a basic exercise and something that you'll probably end up needing to do or wanting to do quite a lot in paediatrics. So, in terms of the basic principles of plotting, what information do you need to plot a child on a growth chart? Age,
gender,
yeah,
how much they weigh.
yeah. So their growth parameters, their height, their weight, their head circumference. And then if you're going to be really OSCE style about it, you want their date of birth, their hospital number, their name, to put it on the chart. You can find that away in the notes and say that you've done it and get the mark. Okay. So when you've plotted it, okay, you then want to describe the centiles. That was something that we was murmuring around. And then when I was asking, oh, where was his weight centile at 8 weeks, it was a bit more hesitant, wasn't it? So how do you describe the centile? Do you know what the principles are? It's very nice if they're on the line. You say, oh, this child is on the 50th centile. That's perfect. What about if they're between lines? Have you guys been taught any basic principles of that? No? Okay. So the way that we're advised to do it is if they're within a quarter space of the line, so there's spaces between the lines, and if they're within 1/4 of that space towards one line, then you describe them as being on that centile. Okay. If it's more than a quarter space, so in the sort of in the mid quartiles, then you describe them as being between the centiles. Okay. So the way that you would have described his weight centile at 8 weeks was between the 9th and 25th. So it's much, it's probably simpler than we think. Yeah. So that's fine. We can plot them on a line and talk about them being on the 25th centile and 75th. What does a centile mean?
If you had 100 people in a line, they would be, say, like the 25th, and they would be 75 bigger than him if he was the 25th centile.
And 24 smaller than him. So it's based on this idea of a normal distribution, isn't it? So that you're going to a few people that are really tall and really heavy, and a few people that are really small or really light, and everyone is somewhere in between. Okay, and most people will fall in that middle part of the bell curve when they. You'll remember that bell curve from the stats lectures we all fall asleep in. Yeah. So that's the basic idea of it. And that's very nice. So what do we expect for a child that's normally growing? Where would you expect their height and their weight and their head circumference to plot on the centiles in relation to each other?
You expect them to stay roughly along the centile where they've stabilised.
Yeah, so as they grow, so with time you expect them to grow along that line, or as close to that line. But you expect the three parameters to be on the same line in each, the same centile in each. So you expect the child that is on the 50th centile for weight to also be on the same for height and the same for head circumference, and likewise the other way around. Does that make sense? So what if they're not? What if their head is on the 75th centile, their height is on the 75th centile, but their weight is on the 10th? Or the 2nd centile? What do you think of that? Is it? They're as tall. Their head is as big as they are tall, but they're lighter than their height and their head circumference would suggest. So their head circumference and their height are both on the 75th, but their weight is much lower.
Like failure to thrive.
Anything else? Any other ideas?
Could be an anomaly.
Could be an anomaly. Anything else? What if it was persistently like that?
A syndrome.
Yeah, you sort of wonder if actually this child is not thriving, like you said, because their height and their head circumference are being preserved, and yet they're not putting on weight for whatever reason. Okay, and that's something that you might see in children that are not thriving, because our body will preserve nutrition to our brain and to our head, and preserve nutrition to our bones so that we can grow, but will perform less sort of fat deposition and all of that kind of thing. You get less tissue production.
So it's more common to happen that way than the other way around. Then.
You're more likely to become light first than you are short first. Does that make sense? Yeah? So, have you heard of the concept of a symmetrical and asymmetrical IUGR? Have you heard of that term? Yeah? What do you know about it?
So it's not in proportion. It's growth restriction in utero that's not in proportion.
Yeah.
It's like what you just were saying. Well, they have a big head and a small body.
So their body is smaller than it should be for the size of their head. So, for example, if you've got a baby that's had a placenta that's not been working properly and not been delivering enough nutrition, that baby will come out with a head of whatever centile, say for argument's sake it's on the 75th centile. But if it's not been having enough nutrition, it won't deposit much fat and will have less reserves, less muscle bulk. So this baby may come out lighter. So it will have a head circumference on the 75th centile. Maybe the length will be preserved as well, but it may come out weighing less than it should do. So that's what we call an asymmetrical IUGR. So what's a symmetrical IUGR?
Where everything.
Exactly. And any ideas what that might make you think of?
Smoking?
Smoking will probably give you placental insufficiency. Yeah, it might do in severe cases, yeah. So often, so the way I think of it is if you've got a baby that's disproportionately small, so the head is bigger than the body suggests it should be, then there's probably something wrong with the placenta. But if everything about the baby is small, there's probably something wrong with the baby. Okay, so it's probably some sort of syndrome, some sort of developmental problem, embryological problem. Okay, that's very broad brush strokes, but that's a base principle that I found quite useful in the past. Okay, is that helpful? Okay, so we'll move on and get back to growth charts and start thinking about sort of plotting term and preterm babies. So before we do that, the basics. What are the basics of what's a preterm baby, what's a term baby?
Term from 37.
37 weeks. So above that is term and below that is preterm. Yeah, so that's really important. We need to remember that. Okay. Now you can plot the guidance from the Royal College of Paediatrics that produce these charts that you're holding, along with the WHO. They suggest that actually you can plot a term baby that's anything between 37 weeks and 39 plus 6 weeks on a preterm chart. And the reason they say that is because the gaps between the centile lines are bigger because it's all been blown up, so it's easier to see. Okay, but once they get to 40 weeks or 42 weeks corrected gestation, then you have to plot them on an infant chart. Okay. Does everyone know what I mean by corrected gestation? Any ideas? How about you, Sam?
I don't know, I guess would be, is it based on if they do the scans and date the pregnancy like that rather than just saying last menstrual period?
Yeah, so in practice both of them are done. You date a pregnancy based on last menstrual period and the scan, and often if they're different from what I understand, my ONG is pretty poor, but from what I understand they usually go with the scan dates. Okay, because your last menstrual period can really vary quite widely.
So this is where you're correct about that they were really early, so if they're born at 32 weeks, you can't then start them at the 0 week birth line because they were 32 week gestation babies, so you would expect them to continue to grow like they would have done if they hadn't been born until they get to what would have been term.
Yeah. Does that make sense to everyone? Yeah. So that's basically it, is you're catching the baby up to where they should be. So if a baby's born at 30 weeks, you wouldn't expect them to weigh the same as a newborn term baby, because that's just not fair. It's an injustice. And so you would correct that on the growth chart, and I'll show you how we can do that. Okay? Do you know how long we correct gestation for? This is something that I had to revise the other day.
1 year?
Yeah?
Or 2 years if it's less than 32.
Yeah, exactly. Where did you guys read that? I had to read that up yesterday. Declaring this to paediatricians on the camera. Fine. So yeah, that's exactly right. If they're 32 to 36 weeks, you correct them for a year. And if they're below 32 weeks, you correct them for 2 years. And that's just a base principle of, this baby's been born 2 months earlier. That's a significant proportion of this baby's life. So give it a chance to catch up on the charts. Okay. So have you guys been involved in plotting preterm babies on the charts? No? Okay. So I've copied some here. These are post-term charts. So we'll hand out a couple of these. This is for 2 weeks to 6 months old. Probably not got enough to go one each. More of you turned up than I expected. We've got a couple spares. Anyone want any more? Someone at the back? Or are you guys in the same group? She didn't let me keep one. What if I keep one? I don't know what we're talking about. There we go. Okay, so what have we got here? So we've got another little exercise in plotting preterm babies, which I did have somewhere. I got a bit excited printing this stuff off, so now I had to look through it. Okay, so what have we got here? So if a baby turns up at 23 weeks, weighing 6.5 kilograms, do you want to plot that? Sorry, I didn't make that clear.
23 weeks.
6.5 kilograms. How many weeks, sorry?
23 weeks old, weighing 6.5 kilograms. I can plot this as well with you. So 23 weeks. Okay, everyone plotted? Yep. So what have you got? What centile have you got?
No.
Yeah, so it's about the 9th centile, isn't it? Yeah. But let's say that this child was born at, let's be nice, was born at 30 weeks gestation. Okay. So where does that correction bring you?
1, 2, 3, 4, 6, 7. Yeah.
Did you do it to 37 or did you do it to 40?
37 is 37 is 10, isn't it?
He was born at 30 weeks gestation.
30 weeks.
5, 7 weeks.
Yeah. So then you go to 7 weeks.
Circle between 25th and 50th.
Yeah.
Okay, I'll give you another 30 seconds.
It's normal. It's normal. So you want to
Sorry? So the baby today is 23 weeks old and weighs 6.5 kilograms. If you plot it today,
40 weeks.
and where would it plot if it was born at 30 weeks? So I want you to do the corrected weight plot.
So you wouldn't bother collecting it after that.
Okay, everyone plotted? Happy? Okay, so what have you got for today's weight at 23 weeks? The centile ones. So everyone got it on the 9th centile, is that right? So if you do it the corrected way, if he was born at 30 weeks, where does he plot? Which centile?
25th.
25th and 50th.
Any other ideas? Any other suggestions?
Between 50th and 75th.
Okay, so we've got 2 answers there. I won't declare which one I've got. But how did you get between the 25th and the 50th?
3, 4, 5, 6, 7 weeks.
Okay. So how did you guys get between the 50th and 75th? About 10 weeks.
Right.
Which one is it?
Second one. I'm going back.
What? Have some confidence. Have some confidence. No, they're right. It is the second one. So why do we do that? Yeah, we correct to 40. So the principle is that you can plot a preterm baby on a term baby on a preterm chart up until 39 plus 6 weeks, but thereafter every baby is corrected to 0 at 40 weeks. Does that make sense? Yeah. So once you've gone past term, which is your estimated due date, expected due date, whatever the EDD stands for, that's expected at 40 weeks. So if you're born at 37 weeks, you're born 3 weeks before that. But when you come to plot them on the infant chart, which is for a year old, or when they finish that, then you start them off at 0. Does that make sense? So when you're correcting to term, you correct 40 weeks. So I would plot this baby on the 50th to 75th centile. Okay. But now what you've got is you've got 2 dots on your chart. So the next person coming to have a look is not going to know which is which, and they're going to wonder if you've made a mistake. Do you know how you clarify what you've done there?
Arrow.
Yeah, so you draw a dotted arrow or whatever, pointing towards the corrected one. So can you see what I've done there in my beautiful scroll?
Yeah.
We've got one dot here, and the corrected dot here, and I've just drawn an arrow towards it to say that I'm going back 10 weeks. Okay, does that make sense? You sure? It looks like it's not a little bit clear. Yeah, you sure? Okay, fine. Have you got any questions about any of this at this point? Yeah, it is a bit of a whistle-stop tour in growth charts.
When they made these growth charts, wasn't it a really long time ago? It was just white babies. Or have they updated the data?
These are updated charts. These have been made in the last 2 or 3 years.
Okay, so it's pretty...
Yeah. I don't know which ethnicity babies they've chosen and what they've been feeding them,
Yeah.
but these are the updated versions. But it's worth. It's a decent question actually.
And then for 2 years, in this case, on the other chart, you always draw both points and label it correctly.
Yeah. So you know that you can compare them to the babies that are their actual age, as well as the babies that are their peers in terms of their gestational age. Does that make sense? Yeah. So we talk about a chronological age, which is how old they are from their date of birth, and a corrected gestational age, which is how they're actually supposed to be. Okay. Do you mind just shutting the door behind you? Is that all right? Thanks. So any more questions at this point? Okay. So we've just gone through some of the basic points of growth charts. What, any sort of, just 1 or 2 people, I hate going around the room and doing this individually because it's painful, especially with so many of you. But any particular take-home message? Is there anything in particular you guys have learned that was new today?
Yeah,
Pick
it's
up
correcting.
which chart you use in the burn
Yeah.
X amount of weeks. Can't use certain charts.
Yeah. Anything else?
The types of IUGR, didn't know about before.
Yeah, that's a useful concept. Yeah, that's really important. So from my point of view, there were 3 or 4 important messages that I wanted you to take home, some of which you may already have known by the sounds of it from the beginning. So it's important, growth charts are important for monitoring your growth overall. Okay, and we've gone through the concepts of centiles and the normal distribution and what each centile means and that sort of thing. You guys already knew about term and preterm, even those of you doing Jerry's, so you'll be fine when you come round to us. And then we talked about correcting gestational age, so correcting back to 40 weeks rather than 37. Does that make sense?
Yeah.
Okay. I was planning on going back and doing the quiz again to see how much you guys had learned, but you kind of knew all of that already, so I won't patronise you by making you do it again. But at this point, before we stop, is there anything else you want to ask me, tell me, show me? No? No? Okay, cool. What I would like from all of you is I've got a feedback form that I'd like you all to fill in, if that's okay. If you wouldn't mind just holding on 2 minutes, I was doing a long line upstairs, so I've not had a chance to print it off just yet. That excuse wasn't for you guys, it's for the camera. So I'll print it off and just get you guys to fill it in before you shoot off. Is that okay? Yeah, just give me 2 minutes, and then when I come back, if you've got any questions, we can go through them as well. It's all right.